That way it all counts. There you go. Okay.
Perfect.
So awesome. Well, nice to meet you guys since we get to do a semester or a shortened semester of it together. So yay.
Yes.
And yay that we're all here. So usually I get on there and we're like nobody's there. They all dropped and it's like, uh-oh.
Uh-oh, biostatistics.
Yeah, sorry, exactly. Especially in this class. Have anybody like already proficient at biostatistics?
Huh.
Good, we all get to learn.
I wouldn't I wouldn't say biostats, but I mean, I've only gone through lesson 2, but I mean that's pretty much just science in general. So
Yes. That's what I was thinking. It seemed more like science structure than it did math structure. I was looking for the math, but maybe it's later on. Section 3, is it? Yeah, graphing.
We got a lot more into math.
okay. Yeah, I got called into work last night, so I got through lesson 2, and that was about as far as I went.
All right. So we're all kind of on that boat together. Well, it depends on Jason to do lesson 3. So I'm not sure. I think they said, so are we supposed to just we do our discussion on the part 2? Is that right?
Yeah, I think it's just part 2 that we're doing. That's what it said. I mean, are we talking about part 3 too, like as well? But
I think we're supposed to do both of them.
Okay.
There's 2 separate.
Yeah, because they're both due at the same time.
Okay.
Yeah, they're separate, but yeah, they're both due, so we might as well knock out 2 birds with 1 stone today. And get it
I
done.
just haven't started that one yet, but I haven't even gotten to part 2 of lesson 2 yet because I just got on this course yesterday.
Oh.
So I will need your guys' support.
That's right. We can all kind of cohort on that one there.
This lesson's super easy.
Okay.
So part 2, it's number 6 is the first one. So it talks about determining the correct sampling method for each scenario and stuff. Okay. So do we just all want to kind of go take turns taking a letter and going over why? We got what we got?
Yeah, let me grab that. Sorry, just...
No, you're fine. And I cheat because I print it out because I can't go back and forth on the computer with the lesson book and the homework. So I've just printed it. So that's why I'm easier to read it real fast.
Is there an answer guide on this one too?
Yes.
Okay.
Yeah.
Let me pull all this up.
For which paper are we going
part
through?
2.
This is lesson 2, part 2.
And part 2 starts at 6, right?
Yes.
Okay.
My energy of the day.
At the sampling stuff. Okay. All right, there we go.
And everybody found it?
Yes.
Yes.
Okay, so I'll do A. It says a medical student researches the prevalence of aspirin usage by questioning all the patients who enter her clinic for treatment. So I picked convenience sampling because she's doing it in her office with her patients, so it's an easy poll to take, and she's not varying with others or being random at all. So I got convenience.
Me too.
That yeah, I'll agree with that.
I can take B.
All right.
Says the Colorado Department of Health obtains an alphabetical list of 2 million adult Colorado residents and constructs a pool of survey subjects by selecting every 1,000th name on the list after randomly choosing one person from the first 1,000 on the list. I chose systematic for this one because, well, systematic's the one where you take, you do that math, I guess. Yeah, you divide it by how many you want, and then you pick a random one between that first group, and then add like for this case, 1,000 after every one.
And I thought systematic is the easiest one to remember just because it seems like it has a system. Like if there's a protocol, it's a system.
The most complicated, and it's a system.
It's a system.
All right, I can do C. So it says in a Gallup poll of 1,059 adults, the interview subjects were selected by using a computer to randomly generate telephone numbers that were then called. Obviously, that's going to be the random sampling because you're randomly picking telephone numbers.
Yeah. I agree.
Got it.
Same.
Okay, I'll do D. So it says a dietitian has partitioned people into age categories of under 18, 18 through 49, 50 through 69, and over 69. She is surveying a simple random sample of 200 members from each category. So this one is stratified sampling because they are kind of grouped into similar characteristics, and in this case, it's age.
Right.
Perfect.
Perfect. Okay. So E is a Johns Hopkins University researcher surveys all cardiac patients in each of the 30 randomly select hospitals. So that would be a cluster sampling because it's taking groups of similar things and then comparing them to random things.
Awesome.
Everyone get that one? Cluster?
Yep.
Awesome. All right,
Yep.
so number 7. Who wants to do A? We keep going in our circle here.
Yeah, that's fine. I'll do it. All right, 7A. They take a simple random sample of doctors and then sample all of the patients that the doctor works with. I picked cluster for that one because it's just picking a certain group and then doing everything in that group.
Perfect.
Yep.
All right, who wants to do B? Is it? I think we're on. I actually didn't. I didn't catch your name. What was? Sorry,
I'm
you
James.
can't see me pointing at you with my pencil. Don't you know I'm pointing at you? No, just kidding. What, David?
James.
James. Nice to meet you, James. I'm Callie. So James, you want to do B?
Yeah, I can do B. They put all of the residents' names in a computer and used a random generator to get a sample of 100 patients. I went with just random with that one as well, the simple random.
All right, for C, they divide the residents up by gender and then do a simple random sample of the residents within each gender. So this one is stratified. That's what I put.
Me too.
Yeah, they're breaking it up into characteristics.
Yeah. So they randomly pick key intersections in the city and then picking every 5th person that walks by after randomly picking one of the first 5 people to be in the sample. So I pick systematic.
Yeah.
Me too.
Yep.
Perfect.
All right, for 8A, the Center for Disease Control obtains current flu data by randomly pulling 300 men and 300 women. I picked observational for that one. They're not really doing much, they're just observing.
That's what I got.
Yeah.
Yep. All right. So you plan to conduct an experiment to test the effectiveness of Sleepy's, a new drug that is supposed to reduce insomnia. So you randomly divide 1,000 patients into 2 groups where half get Sleepy's and the other placebo. You record the gender of each subject and you will then observe how many hours of sleep they get in a week. This one, I think it's called experimental something, but yeah, that one.
Yeah.
Where you design an experiment instead of just observing people.
And then we had to put
Experimental design, it says right there.
And then we had to put what I think what they were reserving and then what was changing and stuff on that one as well, weren't we?
Yeah, the response.
The response,
Okay.
yeah.
The response. So the response then is going to be if the people with insomnia do sleep better with the Sleepies, your treatment is going to be the drug, and then your subjects are people with insomnia. Right? Is that what it means?
I think so, yeah. I think for the response, for measurable, it needed to be more like how many hours of sleep they were getting versus how many more hours before.
Okay, how long it takes to fall asleep. Okay, gotcha.
Just so it's measurable. Not that, I mean, obviously, we all know what it means. Yeah.
Right.
Yeah, but yeah, that's what I got.
Me too.
Perfect.
Okay, cool. I can read number 9 and then I'll do A. In September 2004, Newcrest Pharmaceuticals Incorporation announced the results of its first human trial of NPI, blah, 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 a topical form of its skin ointment. A total of 224 patients diagnosed with skin irritations were randomly divided into 3 groups as part of a double-blind, placebo-controlled study to test the effectiveness of the new topical cream. The first group received 0.5% cream, the second received 1% cream, and the third group received a placebo. Groups were treated twice daily for a 6-week period, and the degree of skin irritation was recorded at that time. So A, is this a designed experiment or an observational study? A designed experiment, because it's an experiment. But.
And B is what are the subjects? And I put 224 patients diagnosed with skin irritation.
Yeah.
Yeah, me too. And then the response variable of the experiment is the amount of skin irritation between the 3 groups.
That's what I got.
All right, and then the treatments is going to be the 0.5% cream, then the 1% cream, and then the people who just have a placebo. Normally that's a sugar thing, so I don't know, maybe they're just using a sugar scrub instead of the cream. But
It's normal lotion or something.
Yeah.
Perfect. Awesome. So did anybody have any major questions off of that lesson that they needed? No, it was pretty straightforward, I thought.
Yeah.
Do you know,
No.
do we need to probably stop this one then to record it and then start a new one for week 3? Or is there 2 separate entrance things?
I think
Need to
so,
do the
because
group quiz on
it's
this
2
one.
separate groups. So
Is it 2 separate groups?
it's
Oh,
just 2
so you
separate
have
group
to
postings.
On the
Okay, so we need to save this one to
Yeah.
post and then do a new one to post in the 3 one, right?
Yeah.
Okay.
Yeah.
Let's all pray that I
Unless
know
we-
how to do this right. So I assume I hit stop broadcast and then we should be able to update the YouTube link. Is that kind of the way this works?
I think we need to do
think
this
so.
quiz together first, though, before we end this one.
Oh, yeah, we do the quiz.
Oh my gosh, yes, I forgot.
Oh, yeah.
Good catch on that one. Let me pull that up. I knew there had to be more to this than just going over the homework.
It'd be nice if it was that simple.
That's right. Let's see.
Oh, whoops, that's lesson 3 quiz. Let's not start that one yet.
All right.
Group meeting quiz.
So do we all do it together?
I think
Or is it
so.
just one person?
Yeah, the first 2 questions are just the individual questions. It's like, did you complete the individual preparation prior, and then like if whether or not we actively participated in this group meeting. So,
Oh, okay.
but then 3 through 15,
I see.
I think are.
Yeah.
Okay, so I'll read question 3 so we can kind of start working on that one. It says researchers would like to determine if reviewing material consistently within an hour after class helps students perform better on exams than if students wait to review material the day before the exam. To answer the question, the researchers are trying to determine if an observational study or an experiment would be more appropriate. They are discussing who the population would be and how they will determine which sampling method will best represent the population. Which of the 5 steps of the statistical process are the researchers currently applying? So I think they're designing the study.
Yeah.
Yeah, I agree.
Yeah. Agree with
It's just
that.
a one answer thing, right? It's not like multiple choice.
Yeah.
Okay. Perfect.
I can read question 4.
Perfect.
A researcher has collected the results of a survey where the participants were asked how many hours of TV they watch each day. The researcher tallies the frequency for each category and computes the mean number of hours she watched. Then she creates a histogram to help illustrate the overall distribution. Which of the 5 steps of the statistical process did the researcher apply? I would say, well, she already collected the data, right?
I think that's
Yeah.
what she did in this
Is
one.
that what she's doing, or because she's not really taking action? But
And she's not really describing it, she just created it.
Yeah, so she created a histogram to help illustrate. That's why I'm wondering if she's taking action just because she already collected the results and then she's creating a histogram off of those results.
Oh, that's true, because the beginning says has collected.
Yeah, so should we do take action?
Yeah.
Okay.
Well, isn't taking action changing something afterwards?
That maybe she's describing the data.
The data, that's probably what she's doing,
I
yeah.
think she's describing.
Okay, yep, let's do that one.
That sounds right.
All right.
I'll do number 5. Says Mumbai, India is a quickly growing city of importance in its own city as well as the global economy. A marketing research firm has been asked by a prominent fast food restaurant to help determine if the citizens of Mumbai would support this fast food business. From a list of all registered taxpayers, 3,000 names are randomly selected. Each individual on the list is mailed a brief questionnaire. The researchers received 1,049 responses. The population is
That's a good question.
I think it's the citizens of Mumbai.
yeah, it's there's this question just like this on the personal quiz, and it was all the citizens.
Yeah, because while only 1,049 people responded, the whole population is still
Yeah.
in
It
Mumbai.
represented them.
Yeah, exactly.
Right.
Yeah, so it's citizens.
Yep, I'll agree with that.
Perfect.
All right, so the next question is the same, except for we want to know what the sample is. And so in that case, the sample is the 1,049 people who respond.
Yes.
So the population is the overall number then, and the sample is going to be the specific number?
Yeah, this is the number of like participants, I guess, like the people who did respond, yeah.
Right. All right, I can do the next one since that one was pretty much the same. So studies have shown that retention of classroom materials can drop as low as 58% within 15 minutes of class and within 44% after the first hour. This forgetting curve continues so that within 6 days, only 25% is remembered. How can a student conquer this forgetting curve? The researchers in the study claim that constant review is reported. Suppose your teacher wanted to test this and invite you to participate in a study where you were asked to review the specific material 15 minutes after class for 10 minutes, an hour after class for 10 minutes, and then 2 days after class for 10 minutes. Your teacher then gives you a short 10-question quiz where your score out of 10 is recorded. What type of data is your teacher collecting? I think that would be quantitative since she's taking a score out of 10.
Yeah, I agree.
Mm-hmm.
Yeah, it wouldn't be categorical because
the number actually means something. Yeah. A higher number or less number.
Right. Right.
Okay. So then question 8 is the same question, only at the end it says, suppose your teacher wanted to test this and invited you to participate in a study where you were asked to review specific material 15 minutes after class for 10 minutes, an hour after class for 10 minutes, and then again 2 days after class for 10 minutes. After the 6th day, your teacher asks if you would feel confident you have retained at least 50% of the material. He then records your response as yes, no, not sure. What type of data is your teacher collecting? And that would be categorical because it's not a specific measurable number.
Right. And then the numbers of who says yes, no, or not sure are more important than the responses themselves.
Yeah.
Okay.
Number 9, it's the same, and it says, suppose your teacher wanted to do this test and invited you to participate in a study where you were asked to review the specific material 15 minutes after class for 10 minutes, an hour after class for 10 minutes, and then again 2 days after the class for 10 minutes. Your teacher also selects a group to give no review to the material over 6 days. This group is called so it's saying that the teacher selects a group that doesn't have any review?
Right.
Right.
Yeah.
So
control group, right?
Yeah,
right.
Control group because they're not
doing anything different than they normally would have done. Placebo group, I guess.
Yeah, exactly. Nothing's changing.
And plus, I don't think any of these other groups or things anyway.
I know. I've never heard of any of these.
I think that's the only one that's a real thing.
All right.
Okay, I can do 10. Which of the following would be considered an experimental design? A telephone poll asking people about whether or not they vaccinate their children? No. Administering the tuberculosis vaccine to one group and giving a placebo to another? Probably. A census? No. A mailed survey asking people whether or not they received the tuberculosis vaccine? No. So it'd be the second one.
I'm going to go with number 2.
Yep.
Okay. Question 11 says, in a study to determine the average wage of working people in Mumbai, which of the following would be the best sample? Every 10th worker that you meet as you travel the streets of Mumbai, all of the workers in one working district of Mumbai, all randomly selected workers in each of several working districts of Mumbai, or all female workers. I'm thinking it's number 3.
I agree.
Me too.
With that.
You want me to do that? I can do this one. You want to
All right.
become? Oh wait, did someone else want to do number 12?
Oh, it doesn't matter.
Okay,
Go ahead.
I'll do it.
All you.
Okay. You want to become the next Jonas Salk and produce a vaccine that will help cure children of respiratory RSV. You test the vaccine and compare it to a placebo and randomly choose one group of children to take the vaccine and one group to take the placebo. What or who are the experimental units or subjects? The children, right?
Yep.
Yeah.
Well,
So the
Yeah.
vaccine and placebo one is the one I'm questioning.
that's what I'm wondering. Is it the children or
Well, those would be the treatments.
Oh, that's
Is
true.
it-
The subjects are going to
subject,
be those
so-
people. Yeah.
Yeah, that's true. So
Yep,
I'd say the
subjects
children,
are the children.
Yeah, I agree.
which would make number 13 the vaccine and placebo because we just said they're the treatments.
Yeah.
Right. Yep.
Yep.
All right, I can do 14. So 1990.
Are we think we're on 13, right?
Or 13 we said was the vaccine and placebo.
Oh, sorry, I was not listening at that.
No
Sorry.
worries.
It's all good.
All right. So in 1992, the U.S. government supported a study that was run for 15 years where 4,608 low-income families were given a chance to move to less impoverished areas. They distributed vouchers and provided various support systems. The researchers wanted to determine if getting people out of poor neighborhoods would reduce the poverty level of U.S. citizens. The low-income families were randomly assigned to one of the 3 groups. The MTO Low Poverty Voucher Group, which received Section 8 certificates or vouchers usable only in low poverty areas, areas with less than 10% of the population below the poverty line in 1990, along with counseling and assistance in finding a private unit to lease. The traditional voucher group, which received regular Section 8 certificates or vouchers, geographically unrestricted, and ordinary briefings and assistance from the local public housing authorities. And the control group, which received no certificates or vouchers but remained eligible for public or project-based housing and other social programs to which families would otherwise have been entitled. This study was definitely an experiment. So they were taking people out and putting them somewhere else, not just observing what happens.
Yeah, I agree.
I agree.
There's a lot of words to ask that question.
Yeah, holy cow.
Okay, so just matching. That's not too bad. So step 5 is take action. Is number 2.
Just match the letters.
Yeah. Step 2 is collect data. Step 1, design.
Step 1 is design.
3, describe.
Step 3, describe. Oh, step 3 is
Step 4, make references.
So it should be, I got 25413.
I got 32542.
So I think it's all mixed up.
Oh,
So let's just.
Oh, is it?
Step
Okay.
1 is design a study.
Yes.
Step 2 is collect data.
Yes.
Step 3 is describe the data.
Yep.
Step 4 is make inferences. And then step 5 is take action.
Okay.
that makes more
If
sense.
we're
I
gonna
was like,
make a
wait,
big
I got
quiz, it should have
completely
the numbers
opposite.
lined up.
Yeah.
I wondered why you were reading them like backwards when you were doing it. Okay, so is that all of them, I think, on that
Yeah.
one?
We submit.
See how we did.
Save, submit.
Hey, we got 'em all right.
All right.
Nice job, guys.
All right. So let's see here. Okay, so I assume now I stop. Is that right?
Yes.
So
Okay.
Yeah, I think we
We've all
probably
got
have
each other's
finished
back, though.
everything.
If this doesn't work out and I don't get a link, we'll tell the teacher we were all together on this.
yeah, for sure.
Okay, so I'll stop it and then I'll start the new one. 1 second.